Anwar Husnoo, Minister of Health and Quality of Life, Dr. Mélanie Zimmerman, Chargé Affairs of the US Embassy, Mr. Gunesh, Senior Chief Executive, Dr. Mrs. Timol, Director General of Health Services, Regional Health Directors, Dr. Anwar, Acting Regional Health Director of Victoria Hospital, Dr. Khalid Choudhu, Coordinator on Neonatal Services and Consultant in Charge in Paediatrics, distinguished guests, ladies and gentlemen. I welcome you all for attending this Certificate Award ceremony on training courses leading to certification in neonatal ventilation and advanced life support and neonatal critical care nursing. These trainings are being run in collaboration with PICU-Nurse-International. The director is Franco Carnevale from Canada, a professor of McGill's University, and also with him there's a foundation here called the Neonatal Paediatric Intensive Care Foundation, which support this program. And since last year we have the support of the US Embassy to run these programs and to see how we can improve our service in the care of preterm babies. So I would like to invite Dr. Mélanie Zimmerman to have a speech.
Good afternoon, everyone. Good afternoon, everyone. You got to give me an indication that you're awake. It's the afternoon, it's after lunch. I know we get that little bit of that lull, but just bear with us. Minister of Health, senior executives, directors of the hospital, to borrow a phrase that I learned in Cameroon, all protocol respected, tout protocole confondu, comme ça on n'oublie personne et on ne fait aucune faute diplomatique. Donc, mesdames et messieurs, students, doctors, nurses, friends, colleagues, and anyone who supports this type of extremely important training, please be welcome. I'm very happy to be back here again today. I really can't believe it's been a year since I was here last. The time has really flown by for me. Thank you, Ram, our Mandela Fellow, so beneficiary of the U.S. Exchange Program, for the invitation and the renewed trust that you placed in the relationship with the American Embassy. I really ought to call you Dr. Ram because I know you have an honorary doctorate for everything that you've done for the training, the mentoring, the care, the love, the passion that you have, not only for these premature babies, but also for all of the medical providers and caretakers and supporters to make all of these training programs possible. I do wonder some days, Ram, how many lives you've impacted, how many babies you've helped, how many families you've supported. Directly through your care, and you were telling me just now that you have a case that you need to run back and take care of, but also through all the training that you've done, the force multiplier, the training of the trainers. And that's where you realize how big of an impact a single individual can have when he's supported by the appropriate governmental authorities, by researchers, by trainers, and by all of you as well. Je suis moi-même mère de 2 garçons en pleine croissance. J'ai traversé le continent africain de bout en bout, quand j'étais enceinte aussi. Je sais que c'est pas toujours facile. Je sais qu'il y a des milliers de femmes et d'hommes et de familles qui sont dans des situations médicales précaires et qui ont besoin de notre attention, qui ont besoin de la recherche, qui ont besoin du soutien, qui ont besoin du dialogue, que vous qui avez reçu cette formation allez pouvoir leur apporter. Pour moi, la situation de la femme, de la santé de la femme et la santé de l'enfant, du nourrisson, prématuré en particulier, est d'un particulièrement grand intérêt pour moi. Vous savez, la grande prématurité du nourrisson, c'est une réalité. C'est une réalité dont on ne parle pas toujours. C'est une réalité dont on parle parfois trop pudiquement. Ça se chuchote. Vous savez, Madame Attal et Attal, son bébé est arrivé un peu tôt. Et ça ne devrait pas être le cas. Quand on a des contes de fées, comme Cendrillon, La Belle au bois dormant, Podane, tous ces contes de fées qui ont bercé en tout cas mon enfance, ils commencent toujours par quoi? Il était une fois, n'est-ce pas? Et ces contes de fées se terminent souvent enfants, ils vécurent heureux et eurent beaucoup d'enfants. Mais la réalité n'est pas tout à fait la même chose, n'est-ce pas, que les contes de fées. Reality doesn't conveniently match the fairy tales that we read as children. You might get married, you might not, but probably not to a prince or a princess, unless of course you're really lucky. You start a family? Well, you can try and start a family. It can take time. It can be complicated. You may struggle with infertility within your couple. You may have miscarriages. I had 2 myself before I was able to carry to full term. And pregnancy, even when healthy, does not preclude from a preterm birth and all of the complications that come with a preterm birth. I cannot recall a single fairy tale that includes something in it like, and the prince and beautiful princess spent the next 12 weeks sleeping in the NICU in an uncomfortable chair, rarely showering, sometimes eating, caring for their little prince that was born in haste, and being terrified every single day. That's not in a fairy tale, but it is a reality for so many mothers and fathers, and for all of you who are practitioners working in that field. But thankfully, like in fairy tales, there are fairy godmothers, and there are fairy godfathers, those precious, caring medical staff that do watch over those little prince and little princesses that were such in a hurry to be born. And they are you. En croire les chiffres de l'OMS, publiés en novembre de l'année dernière, chaque année, 15 millions de bébés naissent en grande prématurée. En découle 1 million de décès en 2015, c'est énorme. Les complications des naissances prématurées sont énormes et surtout ont un impact sur la mortalité des enfants en dessous de 5 ans. Les 3 quarts, on me dit, pourraient être évités. Mais vous le savez, vous êtes tous des professionnels, moi je ne le suis pas. Preterm birth is a worldwide challenge and it affects disproportionately Asia and Africa. It disproportionately affects countries like Mauritius and other countries in the Indian Ocean. But believe it or not, the United States is sadly in the lead and among the 10 countries with the highest percentage of preterm births, with about 500,000 cases reported, according to the WHO in November of last year. More than 3/4 of preterm births can be saved if they're provided with effective and inexpensive care. Antenatal steroid injections, for example, but my favorite, the kangaroo method. I'm not sure you call it the kangaroo method in Mauritius, but at least it's what we call it in the United States, which is basically skin-to-skin contact, right? Allowing a mom or a dad to be able to hold their baby, no matter how weak he or she is, and just to hold them against their skin, to feel the warmth, to smell their mom and dad, to feel the heartbeat, to have that human contact, not just the beeps and the flashing lights in one of the incubators. I just read a remarkable story, and I encourage you when you go back to your homes or your offices to look it up on YouTube or Google it, about a case in the United States called ICU Grandpa. Anyone hear about that one? So he's an American businessman who's been retired and who found a new passion. He found sort of a raison d'être, a reason to live, something that really motivates him. Twice a week for the last 12 years, he visits the NICU ward in one of the hospitals in Atlanta, Georgia. And twice a week, he has become a professional cuddler of preemie babies. Doctors credit him with improving preemie health. They say that thanks to contact with him, they grow faster, they feed better, they assimilate medication more, and they come out healthier. What's his job? Basically, he's just an old retired guy who holds babies, he sings to them, he gives them a bottle, and he's there when the mom and dad can't be, or when the professional medical staff just doesn't have the time to sit there and hold a baby and caress his or her head and sing to him or her. Pregnancy is sometimes accompanied by complications. We all know that. In our fairy tales, it doesn't, it just happens. But in reality, there are a lot of complications. And this is where you, the doctors and nurses that have just gone through this extraordinary training, come in. As neonatal nurses, as doctors, in addition to fostering the strong ties with the physicians, You also have a crucial role to play between that baby, the medical establishment, the parents, the new research, the new technology. You help the moms and dads, the aunts and uncles, the little brothers and little sisters cope with the challenges of having that premature baby. It's not a thing in an incubator. It's a family member. It's a little prince. It's a little princess. You have the noble task of helping the babies and supporting the parents in these trying times. Of the premature babies, you're there to alleviate pain. Sadly, you're there to improve the quality of life for those cases where the little prince or little princess just won't be able to make it. You give the parents and you give the babies dignity, even if you know that medically there's not much to do. Life is not a fairy tale, especially when the story takes place in a hospital, in an ICU, with an incubator, and the PPE, and the flashing lights, and the inability sometimes to hold your baby the way that you might want to. But you are well equipped. Vous avez appris énormément. Vous aurez des jours, et oui, des nuits, quand vous êtes astreinte, when you're on call, difficile, quand il va falloir aller s'occuper de ces bébés et de leur famille. Mais ne perdez jamais de vue votre mission, de prévenir, de guérir, de soulager et d'accompagner. Demeurez la marraine et le parrain des contes de fées qui veillent attentivement et précieusement sur chacun de ces petits princes et de ces petites princesses. Félicitations.
Thank you, Dr. Mélanie Zimmerman, for these inspiring and motivational words and stories. I would like to request Mrs. Anya to come forward to us and offer bouquet to Dr. Honourable Mohammed Anwar Husnoo, Minister of Health and Quality of Life, as a token for respect. I request Mrs. Sadula Waida to offer bouquet to Dr. Mélanie Zimmerman for his inspiring and motivational words. Now, I invite Dr. Honourable Mohammed Anwar Husnoo, Minister of Health and Quality of Life, for his keynote speech. Thank you.
Dr. Mélanie Zimmerman, Chargé d'affaires, Embassy of the United States of America. Mr. Gunesh, CEO, Chief Executive of the Ministry of Health. Dr. Mrs. Timol, Acting Director General of the Health Services. Directors of the Health, Directors of Health of the Ministry. Dr. Kawasa, Acting Regional Health Director, Victoria Hospital. Dr. Shetty, Consultant in charge of Paediatric. Dr. Mudhoo, distinguished guests, ladies and gentlemen, good afternoon. Firstly, let me say it's a great honor for the U.S. Embassy for supporting the training of our staff in this particular field of healthcare. Ladies and gentlemen, according to the World Health Organization, an estimated 15 million babies are born prematurely each year, accounting for about 10% of all babies born worldwide. In addition, almost 1 million children die each year due to complications of premature birth. Many survivors face a lifetime of disabilities, including learning disabilities, visual and hearing impairment. However, more than 3/4 of these premature babies can be saved with adequate and cost-effective care. There are many examples, and one of those is neonatal ventilation and advanced life support in the postnatal period. Since its inception, neonatal ventilation has been considered as an essential tool for managing premature neonates with respiratory distress syndrome and is still regarded as an integral component in the neonatal respiratory care continuum. Prior to the early 1970s, neonates either died without access to appropriate ventilators, or they were supported in the first days of life with pediatric volume ventilators. I graduated in 1977, at a time when neonatal intensive care was being developed. In all the major centers, I would have been a neonatologist. Well, coming back to Mauritius, the prenatality rate in Mauritius is 17.3% of live births for the year 2014. The actual numbers of preterm babies in Mauritius were 2,201. Around 85% of admission in our neonatal intensive care unit are preterm babies. Ladies and gentlemen, the neonatal ICU bed capacity is about 15 for the whole island. Despite the fact that we have these three fully functional neonatal intensive care units in a different regional hospital with a bed capacity of 15, it is still inadequate because of the high refusal rate due to length for admission, that is, in the neonatal unit, due to the lengthy stays of the extreme premature babies. In view of the limited bed capacities for critically ill neonates, the Ministry has decided to increase the number of bed capacities significantly. Hence, it is projected to have a national neonatal intensive care unit at Victoria in March 2018. With a bed capacity of about 14 to 18, this new facility here in this hospital will cater for the critically ill preterm babies from anywhere across the island. Furthermore, we also project to open a neonatal ICU at City Hospital in the early 20 next year, starting with 4 beds capacity, and which shall be increased to 6 beds eventually. I have been made to understand that regarding the NICU at City Hospital, work is going to start soon, and hopefully we plan to launch the neonatal service there at City Hospital in 2018, early 2018. In the same breath, the Ministry plans to inaugurate a fully fledged neonatal intensive care unit at the new flat hospital project when that will be operational. Hopefully that will be in a couple of years, because it's new hospital we are planning to flat. Therefore, with the 31 to 37 bed capacity for neonatal intensive care unit, Mauritius will be able to cater for all critically ill neonates, and thus we hope all premature babies born in Mauritius will have the same high standard of care as we have in developed countries. Ladies and gentlemen, I must say that in order to be able to achieve this goal, training is an important, very important aspect. This is why we have embarked on training courses in neonatal ventilation for pediatricians, medical and health officers, nurses, in collaboration with the Paediatric Intensive Care Nurse-International organizations represented by Neonatal and Paediatric Intensive Care Foundation since May 2011. As of now, we have a total of 20 pediatricians who have already been trained. A total of 60 amateurs and 100 nurses have also received a certificate in neonatal ventilation and advanced life support and neonatal critical care nursing. Today, another batch of 19 amateurs and 29 nurses will graduate. These trainings were made possible by the effort and input of Dr. Mudhoo, who is a honorary doctor in neonatal and pediatric ventilation. With his help, many international consultant teams from USA, Canada, Singapore, Turkey have come to Mauritius to sustain the ongoing training and support of our health professionals. This has helped not only to save lives, but also to improve the quality of life of these infants. Today, Mauritius has the lowest infant mortality rate in Africa. In 2016, the infant mortality has reached its lowest point of 11.4. Many lifelong complications have also been significantly reduced. There is a high need for skill and knowledge gain to be sustained and improved as we aim to reach a one-digit figure in infant mortality in the near future. Ladies and gentlemen, last but not least, I would like to thank Dr. Zimmerman, the Chargé d'Affaires of the US Embassy, for the support that has provided for the training of our staff in neonatal intensive care. This financial year, the government has provided a significant budget to improve neonatal intensive care. I'm sure all the new graduates will contribute, together with the other staff in the nursery, to provide a high quality of care, which our first sick newborn rightly needs. Ladies and gentlemen, will count on the neonatal staff of the neonatal intensive care. Because I can assure you, having been in the service here, I've been in the service for a long time. I started in the service in 1982. I knew what we had at the time. Nothing. Nil, as far as neonatal intensive care. I remember when I asked my seniors that we should develop neonatal intensive care in that time, in 1982, I was just shown the door, because we didn't have the money at the time. But I can assure you, you have reached a long way in the last few years. With your help, we can develop it further. That's why I will count on you to develop this service and do it. As a patient needed, our little babies need it. Thank you very much. Thank
you. Minister, for this remarkable speech. Now, it's time for conferring certificates with new graduates. So I invite Dr. Honourable Mohammed Anwar Husnoo to come forward so that we can confer the certificate. So I'd like to call for the certification in neonatal ventilation and advanced life support, Dr. Arifah Mohammed Machine of G2 Hospital. Dr. Abdullah Kushler Riaz of Black Hospital. Dr. Sagat Bhavna of Jawaharlal Nehru Hospital. Dr. Gopal Rajiv of Jawaharlal Nehru Hospital. Thank you, Dr. Honourable Minister. Seychelles National Hospital. Dr. Juman Mohammed Faraz. Dr. Nani Yitisha of SSR National Hospital. Dr. Murcia Sila of Hart Hospital. Thank you, Dr. Mélanie Zimmerman. Dr. Nabi Bakas Mohammed Asir of G2 Hospital. Dr. Nakshadi Adil of G2 Hospital. Dr. Fatak Nirvana of Victoria Hospital. Thank you, Mr. Gunesh. Then, of SSR National Hospital. Dr. Sharkur Shakir Hassan of G2 Hospital. Dr. Sukardeep Archana of G2 Hospital. Dr. Saku Yogesh of Victoria Hospital. Thank you. Mrs. Anya Lalita of Jawaharlal Nehru Hospital. Mrs. Anya Kiran of Jawaharlal Nehru Hospital. Mrs. Vednidhi Chargé of G2 Hospital. Mrs. Mudhoo Devika of SSR National Hospital. Mrs. Mudhoo Vishwani of SSR National Hospital. Mrs. Gulatu Ameshwari of PAC Hospital. Mrs. Bansi Sarika of Victoria Hospital. Mrs. Bhagat Lakshmi Devi of SSR National Hospital. Mrs. Kalyavera Lokeshwari Devi of Victoria Hospital. Mrs. Gokul Bharati of Victoria Hospital. Thank you, Dr. Anwar. I would like to invite Dr. Mélanie Zimmerman again for certification in neonatal critical health processes. Mrs. Gopi Persha Satyavanti of PAC Hospital. Mrs. Yogesa Anju of SSR National Hospital. Mrs. Jagnati Tirani of SSR National Hospital. Mrs. Kanai Dharmavati of SSR National Hospital. Mrs. Kalantari Nativavidi of Jawaharlal Nehru Hospital. Mrs. Kasiran Sarita of PAC Hospital. Thank you, Dr. Adityawan. I would like to invite the secretary again in your speech so I can come to the certification new graduates. Ms. Latsawat Emilia of Victoria Hospital. Mrs. Lavari Pitima of PAC Hospital. Mrs. Marion Marie-Claudine of Jawaharlal Nehru Hospital. Mrs. Matuna Thinki of Clark Hospital. Mrs. Nelman Fatima of GQ Hospital. Mrs. Sadula Binti Waida of GQ Hospital. Thank you, Mr. Gunesh. We'd like to invite Mrs. Timol again for the transfer of certificate to the graduates in the category of Neonatal Nurse. Mrs. Sitamuni Madri of Victoria Hospital. Mrs. Sital Aruna of Clark Hospital. Mrs. Samatran Bhagwanti of Jawaharlal Nehru Hospital. And Ms. Tapsi Yogita of GQ Hospital. Thank you, Mrs. Timol. The PICU-Nurse-International actually has decided that those who have become topper in the examination, final examination. So a certificate of excellence is conferred to one of the topper in the category of amateurs who have succeeded with the highest mark. It was 94.7%. And so the certificate of excellence is awarded. So I would like to invite the Honourable Minister again to ask to transfer the certificate of excellence to the amateur who have an outstanding performance, academic performance in neonatal ventilation and advanced life support course. Dr. Nabibakas Asil of Thank you, Dr. Honourable Minister. Now for the certification in neonatal care nursing. One of the nurses has called Paediatric Intensive Care Foundation. Is always here to support the progress, the development, the skill development and knowledge of nurses and doctors. So those who have achieved the highest marks in the final exam will have a support from the foundation in terms of courses and scholarship that will be informed later on. Before we call for the end of the ceremony, I would like to thank Dr. Honourable Mohammed Anwar, Minister of Health, on behalf of the organizing committee. Thank you very much for this remarkable speech and also to share the plan what the ministry decided for the development of the limited service in Mauritius. Thank you very much, Doctor. On behalf of the organizing committee, I would also like to thank our special guest, Dr. Mélanie Zimmerman, who has allocated her precious time to come here to provide her support and also support to the U.S. Embassy to see how we can progress, make the health sector progress here in Mauritius. Thank you very much, Dr. Mélanie Zimmerman. Thank everyone who has contributed in making this ceremony a success. The organizing committee, Mr. Carlisle, for helping in the organizing this ceremony. So thank you very much. Refreshments are provided at the back, so I invite all of you to join us there. Thank you. So I declare the closure of the ceremony. Thank you.
Which one?